Good afternoon, everybody. Welcome to this talk about the Clinical and Public Health Nutrition MSc degree at UCL. We'll just give it a few more moments before we get started, just to let other people successfully log on. If you have any questions, you should see a Q&A box that you can pop your questions into. Please feel free to do so, and we will answer questions a little bit later during the talk. Yeah, I see people successfully logging in. We'll give it another minute and then we'll get started. Okay, let's get started. So again, welcome everybody. Really nice to see lots of you joining for this chat this afternoon. I'm going to share my screen so you can see the slides I've prepared. And just a very quick reminder that this session will be recorded for viewing later and sharing with other people. And once again, if you missed earlier, you will know that there's a Q&A box. You can pop any questions that you have into that, and we'll do my best to answer them for you a little bit later on. So introduce myself. My name is Professor Nathan Davis. I am lead for the MSc Clinical Nutrition and Public Health MSc at UCL, and I'm also the Director of Education for the Division of Medicine. I'm sharing my screen now. Hopefully you can all see just the title slide. So this is a talk that relates to the 2026 entry for the Clinical Public Health Nutrition Masters program at UCL. Okay, let's get started. So first thing would be why consider coming to UCL? Well, UCL is a great university. We are very highly regarded, and we had the distinction of being the University of the Year last year in 2024. Also next year, very exciting in that 2026 is the 200th birthday of UCL. And there's going to be lots of extra events and lots of new facilities being put up around the university, which of course all our new students will benefit from. A few other facts and figures for you. So the first is that UCL is rated as one of the top universities in the world. We're currently ranked number 9 in the QS rankings. We are always in the top 10, and actually the distinction between the top 10 universities is pretty minimal. They tend to sort of move around a little bit each year, but we've been in the top 10 for, I don't know how many years, a long, long time. Also ranked for our research activity, and there's another scheme that ranks the university performance in terms of the papers that are published, and that's called the NTU ranking, and we are number 3 in the world this year for that. We've got an excellent staff-student ratio, which means that we have lots of staff available to help you with your studies. And also we are consistently high performing pretty much every metric and every league table there is. We do very well in terms of research grant income. We've done very well from the European Union Horizon scheme. And our graduates are also very well regarded when they leave UCL and they go off into the workplace. And they typically, on average, earn more money as starting salary than graduates from other universities. So all that very positive. It's a very positive place to be. We have a very good pedigree, and our graduates do very well. The other thing to note is that this particular degree scheme that we're talking about today is accredited by the Association for Nutrition. What this means is that our graduates are eligible to apply to join the Professional Register of Nutritionists in the UK, and use the title nutritionist. And initially, you can use the Associate Nutritionist letters after your name, which is a NUT, and after a couple of years in practice, you can upgrade that to be a registered nutritionist, which is have the letters RNUT after your name. Uh, this is a size a little bit old now. I was looking earlier to see if we have an updated one. But again, it just goes to show, I mean, this particular program has been running for about 18 years now. It's well regarded. We have a good intake every year, and our graduates come on to be very successful. And this just shows that from the last time we had an extensive survey, I could find the data available. This was 2018, that the vast majority, nearly 95% of our students, are at 18 months after leaving this particular course, have either gone on to higher degree, further study, or were in, high quality employment. So why is this a good course to study? Why might you be interested in it? Well, the program is a holistic view of nutrition at all stages of life and with all health conditions. So obviously we want to know what nutrition is important for a normal healthy life, for healthy living, healthy growth, healthy aging, but we also want to know what the importance of nutrition is in disease, how poor nutrition leads to disease, and how nutrition is an important factor in actually recovering from illness and disease. So there are a number of causes that can result in malnutrition, but these can have massive impacts, both at the individual level and at the public health level. And this particular degree course looks at all areas of nutrition, both again at the individual and also at the community and at sort of national levels as well. And we have got, a large body of work in this area. We have a lot of researchers who work in these sort of fields, and they are able to come in and contribute to the course directly. UCL is a world leader in this area, and looking at all the different factors related to nutrition, obesity, malnutrition, child health, epidemiology, and also psychology related to eating and eating disorders. The one thing it's not is that we're not a food science course. There are lots of other universities that do fantastic food science courses. If you want to look at, learn all about making better products, improve shelf life, fortification, all that type of thing, those are great. This is not that course. We don't do food science at UCL. We only do nutrition, and particularly nutrition related to clinical outcomes. So why is nutrition important? Well, the first thing is that we all have to eat. We can't get away from it. It's something that we have to do every day of our lives because of this, and everybody does it. Then, everybody tends to think they're a bit of an expert at it as well. Unfortunately, most people are looking at lots of misconceptions. And again, when they go to the internet or they go to the media or whatever else, they quite often get misinformation and don't really know what to do with it. But the thing you have to acknowledge is that what we eat will have a greater impact on you, on your health, on your lifespan than anything else you do. Your diet will impact how you grow, how you develop, the likelihood that you will develop disease, and also it has a substantial impact on your overall lifespan. Not just about how long you live, but how well you live as well. So the number of healthy years you have, as opposed to just the number of years. And we look at all these different aspects. So overnutrition, undernutrition, and malnutrition. And malnutrition is just wrong nutrition. I mean, there's plenty of instances out there of things that we would call hidden hunger. We have people who have sufficient calories and maybe even excess of calories in the daily intake, but the other nutritional components of their diet are poor and missing, and so they can end up with nutritional deficiency related conditions. Now, all of these factors, overnutrition, undernutrition, and malnutrition, will cause or are linked to premature mortality, but also linked to the development of non-communicable diseases. Now, I should also point out that, this is not a new area for us. We have been looking at nutrition at UCL for a very long time. So in the picture here, you can see a fellow whose name was Sir Jack Drummond. Now, he was um, working at UCL nearly 100 years ago, and he was UCL's first professor of biochemistry. And he was famous for lots of reasons, particularly famous because he was the first person to work out the structure of vitamin A, which in itself was a major achievement. But what he was more famous for was this. And some of you may be able to identify what this is, but his at the start of the Second World War, there were concerns from the UK government that we wouldn't be able to feed the country. And so it was realized that it was necessary to create a system that became the rationing system to ensure that everybody had the right amount of nutrition, the essential elements of a diet in order to keep them healthy. And so the government came to Jack Drummond and his team and asked them to devise a system that would ensure we had a diet that would maintain their health for however long the war would go on for. And this is it. And it looks pretty poor, actually, by today's standards when you look at it. And you can see that there is sugar and there is fat and there's bacon and butter and cheese and the meat on there. Again, as was more common for the time, the meat has also got large amounts of fat in there. Now we might look at that now with a slight element of shock, think that that's not a healthy diet. But you have to realize that that was the elements in the diet that were in the ration would have to be spread out over a week. Okay, that's not a day's consumption, that's a whole week's consumption. And when you spread that out a little bit every day, and the key thing is that that diet was supplemented with unlimited amounts of fruit and vegetables. People grew their own, but also there weren't rations or quotas on vegetables that they could buy. And so when you take this diet and you supplement it with a large amount of fruit and vegetables and also beans, pulses, all that type of thing as well, it actually became very healthy. And it's not an exaggeration to say that, if we could reintroduce the ration system today, we would actually go a long way to sorting out a lot of the UK's nutritional needs. Now, malnutrition is a problem. Malnutrition is a problem on lots of levels. For the individual, it is very certainly a problem in their health, but also it affects society as a whole. So if we look at malnutrition, and we can see this was published by the King's Fund last year, which is an influential think tank in the UK. So the cost of treating someone's malnourished is around 3 times the cost of treating someone who is not. This is a particular concern because we know that around about a third of people who come into hospital for treatment are malnourished at the point of entry. So estimates suggest that malnutrition may cost the health and care system as much as 22.6 billion a year. That is in addition to the costs of the treatment costs that people would have had otherwise. So if a third of people require 3 times as much cost, we're effectively doubling the healthcare costs for a large number of people. You can also see here that malnourished people visit their GPs more, greater risk of complication of illnesses, more likely to need hospital and care home admission. They're also less likely to be able to hold down steady employment. Other things we look at in the course and other things that are of concern to this to society as a whole, is that obesity is rising, but particularly childhood obesity is rising. You can see here in this figure, this was from the Nuffield Trust, and again was published last year. The green and red bars, essentially the bottom 2 bars on this particular figure here, as you can see, steadily tracking upwards, and they've been steadily tracking upwards for about the last 20 years. There's a slight bump in the COVID year of 2021, but that sort of settled back down again. But even then, that's still increased. And so we're now at the point where we have got over a third of children are either overweight or obese. And that is stacking up health issues for later in life. Overall, obesity, as I said, is a major issue for the country, and with more recent estimates, this was published in national newspapers, a selection of national newspapers. I've just picked out one here in July this year. I was like, yeah, July this year, and this shows that the greater cost to society of obesity are now in the region of 126 billion pounds a year. Um, And the government have said recently that as a leading cause of multiple long-term conditions, including cardiovascular disease and cancer, obesity is estimated to cost the NHS over 11.4 billion every year, with wider societal costs estimated to be 75 billion. It's a major drain on the country as a whole, and it is an area of concern. Also, we consider things like obesity. We're linking to other non-communicable diseases. We've mentioned cardiovascular disease and cancer in the last slide, but also it has an impact on obesity, on diabetes, particularly type 2 diabetes, which is related to obesity, although it isn't always the case. And we have our cute picture here of a baby puzzling over this and says, the more I think, the more confused I get, because it's not true that everybody who is obese will have diabetes or will develop diabetes in the future. And also, we still have people who are uh, generally considered to be of a normal body weight or have the appearance of being of a normal body weight, but will also develop diabetes. And it's complicated, where the fat deposits in the body, visceral fat, the fat around organs has a more substantial impact on overall health than subcutaneous fat. It depends on your age, depends on hormone levels, it depends on any pre-existing conditions. There's all sorts of factors that go into it. But diabetes is a problem. As you can see here, it has been steadily increasing over the last 10 years. And as you can see in the next slide, you can see that it is projected to continue to increase over the next 25 years. So you can see here that in this graph on the left, the forecast is that the world population will increase over the next 25 years. So we'll be from about 8 billion where we are now up to about nearly 10 billion by 2050. But also the proportion of people will continue to increase. And we could be as much as 12% of the population of the global population living with diabetes by 2050, which gives us in excess of 1 billion people living with diabetes, which is a phenomenal number. So in addition to just having lectures, talking about facts, talking through the metabolism of diet and the impact on health, we do lots of other things on the course as well. So you can see some examples here. In this one, we've got some of the students doing labs, looking at body composition, looking at calorie usage, doing energy expenditure studies. We've also got some students there visiting one of our partner hospitals and tasting sort of hospital food. There's lots of things that go on. We have lots of speakers coming in. I think one of the key things to say about UCL and the way we run our course is that we have partnerships and opportunities that are not really available elsewhere. So, for example, on this particular course, we in term 2, we organise for all of our students to have the availability, the opportunity to go and do observer visits in our hospitals. They will go with ward rounds, they will join our clinical teams, and they will get to see what nutrition looks like in hospital at the clinical interface. We also have, great researchers, essentially the people at UCL who write the books that, the rest of the world refer to. So we don't have, there's no point of me trying to lecture everything on the course. I can talk about obviously things I know well, but if we're talking about intensive care medicine and intensive care nutrition, then I will get, the world leading specialist who runs our intensive care unit to come and give that talk. When we talk about pediatric and neonatal nutrition, we'll get the world experts from Great Ormond Street to come and, give those lectures and handle those tutorials. So we have a fantastic resource of people that we can bring in who are genuine world experts in the field in order to teach our students. So there are some degree benefits, just to talk a little bit more generally about it. And the first is that, we have, a fantastic course. You get a really thorough understanding in nutrition science, in metabolism, in understanding how nutrition interacts with the body, how it works in health and how it works in disease. We'll talk about personal diet. We'll talk about, all the different stages throughout life, and the changing requirements that your body has for nutrition, and also how disease occurs and how nutrition interacts with that. We have this holistic approach that will give you a really good understanding of both obesity and malnutrition in the modern world, the way that society is developing and the way that governments and authorities will try to intervene. The societal approaches, the population approaches, and also the individual approaches to try and combat these conditions. And we also more broadly equip all our students with essential skills that they need for life and for developing their careers. So you get good public speaking skills, you get good presentation skills, you learn to analyze data, you learn to write, you learn good critical analysis, which is a really important aspect of the course. So then whatever you go on to do, if you want to go on and work in healthcare, if you want to go and work in further research, if you want to do, something completely different, you will have a core set of skills that future employers will value. And I'll come back to it again and say that we are experts in this. UCL is a world leader in the areas surrounding this course, and we offer a large variety of expert teaching across all aspects of it. The other thing we have is great research opportunities. So at the end of the course, everybody does a research dissertation, and we're able to place our students into research groups and research teams in our partner hospitals that mean they get to do some great, exciting hands-on research. If they want to, other people would rather do a project that is more data analysis, more systematic review, that sort of thing. We've got those opportunities as well. So how we teach the course, just a very brief overview. The course is split into 8 modules over 2 terms. We teach Wednesdays and Fridays. They're busy days. We pack a lot in. So on a Wednesday, the first half of term 1, you would go through fundamentals of nutrition and disease. This essentially is the core module that everyone gets to upskill themselves on nutrition, metabolism, all that sort of biochemistry stuff. There's a reasonable amount that we incorporate in here. But the main point of this is to bring everybody up to the sort of similar standard, because we know we have people that come in from different backgrounds. So some of it, if you've done a biochemical, biomedical nutrition first degree, you're repeating work you've done before. For others, it'll be new, but it's there to make sure that you know all the key stuff for the later modules. The second half of term 1 on Wednesdays, you do a module that's called disease-related malnutrition. So in the first one, fundamentals, we really look at how metabolism is supposed to work. For the second half of the term, we start looking at where it goes wrong and how this leads to disease. On Fridays, we run these 2 modules in tandem all the way through the term: research methods and practical nutrition assessment. These are all about how we gather information, how we analyze diet, how we analyze individuals. We do anthropometry, where we do energy expenditure. We look at research skills. We look at ethics. We look at planning clinical trials. We look at ethical dilemmas. We also consider different ways of gathering data, both qualitatively and quantitatively, and how you do the analysis in each case. Then in term 2, on Wednesdays, the first half of the term, we do therapeutic aspects of nutrition. This is a very clinically focused module. We have lots of people that come in from our partner hospitals to talk about nutrition in the hospital and how it's achieved, both as oral nutrition and as also as parenteral or intravenous nutrition. Second half of term 2 on Wednesdays, we have nutrition and public health. This looks at society. It looks at the interventions that are tried, and it also has some elements of sustainability in there as well. On Fridays, the first half of the term is malnutrition in the community. This looks at the way that communities and organizations organize nutrition. So we look at schools, look at hospitals, look at care homes, look at prisons, look at all sorts of aspects. We look at the way charities work, the way that people are introducing supports for homeless. We also look at sort of wider scale sort of catering organizations as well. And then the last module on Fridays in term 2 is disease and disordered eating. This is another clinical module, and again looks at sort of specific areas within clinical support networks. And we again have a lot of clinical academics and clinical partners coming in to sort of teach on this. Last thing to note is that every single one of our students will do a dissertation, as I mentioned earlier. There are opportunities to do pretty much anything you like. It always has to relate back to nutrition in some way, but if you want to do a project in a laboratory working with cell culture, then that's possible. If you want to do something where we have a lot of people who do sports themed projects, we do projects, we've had students who do projects with dancers and their nutritional needs. We do quite a lot with clinics. We have opportunities to place students in projects in one of our partner hospitals. These are just some, I think we have something like, I can't remember exactly how many partner hospitals we have, but these 4 are very closely linked with the course. If you want to do stuff in the community, we do stuff with food banks, we do stuff with charities. There's lots and lots of opportunities for the research project. As it says here, we regularly place students within the research departments, and every year we come up with, literally hundreds of projects for our students. On the same time, if you come to us and say, I really want to do a project in this particular area, and we can make a link for you and we can work this out, then you can organize a bespoke project for yourself as well. Last slide here is about how we do our teaching. We teach, obviously we have lectures, lots of lectures, but that's not the only way we do things these days. We have workshops, we have tutorials, we have some flipped sessions where you watch, the lectures first, and then you come and do a tutorial based on it. We do some peer instruction stuff. We do a lot of problem-based learning. We have computer classes. We use online tools, software. We do a lot of case study work. We will do practical sessions, as I mentioned, and have lots of, visiting speakers come in as well. So it's not a course where you just come in, sit in a room, take notes week after week after week. There's a lot going on. There's a lot of interaction that we require from our students, a lot of engagement we require from our students as well. So I'm going to stop there. I'm going to stop the share, and I'm going to open up the questions and see what you have for us. Okay, so first question is, are there any research assistantship or similar research opportunities at UCL? I would say that yes, we do have some of these. However, the program that we run for our master's students, all the master's programs we run in the Division of Medicine are quite intense. We only teach on 2 days a week. However, the expectation is that the other days in the week, you are doing this assessments, you are organizing to meet people because you'll be in group projects, you are doing the reading, you are revising. You should consider it to be about the same amount of time as you'd normally spend in a job, So if you're doing it right and you're covering all the work, then there's not a massive amount of time in order to do other things as well. We do know that some people manage part-time jobs as well. Fine, if you can do that, great. There's no problem at all. But if you think about the way that the structure of the course is, by the time you start at the end of September, you'll be very busy all the way up to the end of the year. For teaching in term 1, teaching in term 2, we'll start, usually about the second week of January. That's very busy right the way up to the Easter break. You come back after the Easter break, there'll be some assessments in there, but then you'll be doing your dissertation project full time as well. And your dissertation project, if you want to do something, with hands-on research in a laboratory or something else, you'll be doing that anyway. So the need or the opportunity to do an additional research assistantship, we haven't found it that type of thing works very well, and we wouldn't really recommend it. Okay, is there any hospital training? There's not hospital training as such, but we do have visits to our partner hospitals, as I mentioned earlier. These are observerships. So you will get to sit in the clinic, you will get to join a ward round, you will get to work with dietitians or clinicians or some of the other AHP staff, and engage with them, and you can book onto multiple trips, look at different things, and ask as many questions as you like. but it's not formal training, but it's an opportunity for you to see how nutrition is handled in the clinic. How many students the program accepts every year? That varies a little bit. We are generally on clinical and public health nutrition, somewhere between about 45 and 65 students every year. It varies a little bit depending on a number of factors, but that's about the size of the courses. For a master's program, it's quite a large course. What's the ratio of applicants accepted in estimation? I can honestly say that I don't know offhand. I mean, we do get quite a lot of applications. And what I would say is that if you meet the entry criteria and your personal statement is good, so and you keep what I would say to everybody is please don't Google how to write a personal statement or AI generate a personal statement, because they sort of stand out a bit like a sort of what we really want. We'd much rather see a shorter personal statement that comes from you, that is focused, and really conveys, your interest in the subject area. That's what we want to see. So meet the entry criteria, good personal statement, and it is very, very highly likely that we make you an offer. Okay, I'm a BSc in psychology. Am I still eligible to apply? Yeah, absolutely. No problem at all. We regularly accept people with psychology backgrounds onto the course. What we would generally do is send you a reading list ahead of time, just so you could look at some of the texts that we use in the course in order to get a bit of a head start on some of the metabolism. Books that we recommend are really very good. If you read through those, maybe do a few of the exercises, you'll be fine, actually. Quite often, our psychology students are really quite strong on the course, and they don't have any issue with not having a background in the metabolism and biochemistry at the beginning. What sort of funding options are available for master's students? This will very much depend on where you are, where you come from. There are some opportunities if you search on the UCL website and look at the scholarships and can't say the word, scholarships and bursary page. You'll find that there are some scholarships that are available for everyone to apply to. Then there are others that are country specific or discipline specific. So you may be eligible to apply for those. If you're a UK-based student, then the Student Loans Company will lend money to students who want to do postgraduate degrees. There is, I can see that one of my colleagues just popped the address for scholarships into the chat. I'll see if I can share that with you as well in a moment. And there are also, again, depending on if you come from other countries, depending on the country you come from, there are other opportunities to look for as well. British Council has some sort of scholarships that are available, and also there are national scholarships that potentially people could apply to. Okay, I'm interested in studying a master's program at UCL that covers nutrition, exercise, and eating disorders. Could you advise me on which course are you the most suitable? Well, that's a good question. The clinical and public health nutrition course does cover all of those elements. We do cover nutrition, we do cover elements of eating disorders, and exercise, and energy expenditure is part of the course as well. And we do have several lectures that relate to sort of sports nutrition and physiology. But we also offer a master's program specifically in the eating disorders. So that was a particular area that you're interested in. We also have another master's program in obesity and clinical nutrition, which also may be an area that you're interested in. One of the good things that we do offer, though, is because all these courses are part of the same portfolio and they're related, we have the opportunity to switch between programs. So if you were to come in, for example, on the eating disorders program and wish to switch clinical and public health nutrition or vice versa, within the first term, making that switch across, particularly in the first half of the first term, we can organize those transfers very quickly. what's the most common form of assessment? Oh, that's like I said, but the different types of assessment. So we have some essays, we have some multiple choice examinations, we have some short answer questions, we do several computer-based assessments, we have some poster presentation, we have videos that you have to make. What else we have? We have quite a few presentations of different types. Um, Obviously, we have the dissertation, which is a 10,000 word project at the end of the course. Um, what else do we have in there? We have some things we have to write abstracts. Um, so as those, but which one of those off the top of my head is the most common? I'm not too sure. I'd have to count up to see, but we have a large variety of assessments is what I'm trying to say, rather than it just being one type or another. Well, the entry requirements for this course is a 2-1 undergraduate degree in a relevant first degree, although we are pretty broad on the relevant first degree criteria. If you're in any doubt as to what that might be, feel free to drop us a line and we'll ask you to say what it is. We also take into account sort of professional training as well. So, if you've had a degree but then had some professional experience in a relevant area, we'll consider that as part of the entry criteria. If you have any particular questions, please feel free to drop us a line or give us a call, and we will give you some individual feedback on that. There's a large overlap between the nutrition, the modules, this course, and the modules in the BSc nutrition. I would say that the thematic areas are broadly similar in lots of cases. However, when you get to a master's level, the depth that we cover them in is greater, and the requirement for sort of critical analysis is also greater. So yes, you might learn about let's see, something around the life cycle, nutrition and the life cycle, an undergraduate degree, as part of an undergraduate degree, but at a master's level, the expectation is that you take that to a higher level. Okay, I just applied my request the program a few days ago. Was it considered late? No, we are accepting applications for this program through to sometime around April, I think, maybe even a little bit later. I can't remember exactly what our final date is, but no, you're certainly not late at the moment. In fact, a lot of people will only just be thinking about making their applications at the moment. So you've got plenty of time yet. Would you consider an applicant with a physics BSc? I think yes is the simple answer. We would consider it, but I think we want to have a little bit, maybe get in touch with us, have a bit of a chat, and perhaps tell us about, if you have any other experience as well. Maybe you have a little bit of volunteering experience, a little bit of something else that you've been doing that shows that you have a little bit more, had a bit more interaction with nutrition or metabolism as well. But in principle, yes, I think, we have had people with quite a diverse background. We take it on a case by case basis. But yeah, please get in touch and we can have a one-to-one chat. Could you give some examples of lab-based practicals we would do? So the two main practicals that take place that we're running in term one at the moment, one of those is on energy expenditure. So the way this works is that you, as a student population, undertake these yourself. You will undertake exercise at various levels, from lying down through sitting, standing, cycling on exercise bikes and so on, and then doing cool down periods, things afterwards. And then we'll do what's called indirect calorimetry to measure the amount of CO2 in your breath at the different levels and the different activities, and quantify then the amount of energy expenditure. We sort of teach you how to do that. The other one that we would do in this term would be anthropometry, where we will show you lots of different ways of measuring body composition with skinfold calipers, with tape measures, using BIA devices, and so on, and looking to see how they compare in terms of accuracy. hopefully that's answered that particular question. With the application submitted, how long it takes to receive the offer? Um, that can be a little bit variable. It sort of generally depends on the main holdup is usually referees. So when you submit your application, the application goes into the central administration system. They will then contact your referees and ask them to supply your references. Once your references supplied and all, your transcripts and things have been entered into, the decision is made pretty quickly. More often than not, we wait for referees to send in their answers. But in general, I would say that 4 or 5 weeks is probably a reasonable sort of time. Usually that's what it takes to get everything back and to get the referees to submit their answers. It can be delayed longer than that. Again, it's usually not it's not down to us. It's usually down to not having all the responses back. Okay, would you consider someone with a neuroscience BSc and clinical research for experiencing chronic pain? Yes, it's a simple answer. We would happily consider that. Again, if you want to talk a little bit more about it, please get in touch. I'm not sure whether or not you can see the chat answers being put up. But if you can't see the chat, we have a central admin team contact address, but you'll also find that on the UCL website as well. If you look on the prospectus page on the website, then you will have the opportunity. If you look on there, you'll see the contact addresses. You can drop us a line from there. We're also having, in the notes just appeared in the chat, we have got an in-person graduate event tomorrow evening that's taking place. That will be held at the Institute of Child Health in London, which is very close to Great Ormond Street. Hopefully you can see the chat at the moment, and you can see there's a link there if you would like to register and attend. To do wet lab practicals? No, we don't do wet lab practicals on this particular course. However, if this is a particular area you're interested in, then you would have the opportunity to select a research project that would have wet lab as part of wet lab components as part of the course, as part of the project, I should say. And then, the projects are very clearly laid out. And if that's something you particularly want to do some basic research, then the opportunity will be there for you. Best number to call, again, that's on the website. I think generally speaking, the best thing to do is drop us an email, include a number, and give us a time, and we will call you back. Trouble putting numbers on there is that depending when you call, if you don't get an answer, it can be a little bit awkward. But we're very happy for you to drop us a line, include a number and a time, and we would get back to you or organise a time for a call. Okay, if my reference is also submitted, after that it will take 4 to 5 weeks. It does depend a little bit on the time of year, on the volume of applications that our team are handling at the time. What I would say is usually once we have your references and you upload your degree certificates, documents, all the rest of it onto the admission system, I would say it's less than 4 to 5 weeks, a couple of weeks possibly, once the references are in. In fact, once the reference is in, usually it's a very quick turnaround for a decision at that point. It's usually 4 to 5 weeks because it takes us quite a while for the referees to respond, more often than not. Okay, I don't know if anyone's able to let me know whether or not you can see the chat as part of this conversation. You are able to see the links in the chat. So I think there's only hosts and panelists that can see this. Let me see if I can pop these into okay. Might have to try and put this here. Okay, I can pop these messages onto the screen over here. Hopefully. I think actually you won't be able to at the moment because this is the email that this is the email address you need in order to contact us. Well, someone just said they can see the chat. Okay, fantastic. All right, I'll turn this off then. Okay. Are there any lectures in the labs? No, not strictly speaking, although when we talk about labs, we talk about a number of different places. So although we do talk about, things you would normally look at as laboratories, when we have the practical sessions in there, we also deliver guidance and talks in there. But we also have a number of computer-based sessions. So PC labs, computer labs, if you want to call them those. And we do quite a lot of teaching in there, which is computer-based learning, along with, specialist software, apps, and things like that, that you will work along with throughout the sessions. So, many lectures, we have that sort of format. We don't tend to teach in laboratories. We've got lots of lecture theatres and classrooms and workshops, things like that, that we do the formal teaching in. You mentioned something about going to hospitals and clinical settings. So this is something we offer to our students in the second term. We provide lists of observerships that you can register to attend. So we produce a list. It's on our teaching website. You click onto those, you book into one you like to see, and then you can book on, more visits as the term progresses. So, for example, if you wish to attend one of the diabetes clinics, you can attend that and see how those are run. If you want to attend a ward round, maybe one of the surgical ward rounds, or maybe one of the sort of specialist teams, kidney teams, liver teams, things like that, you can join a ward round with them and go into the hospital and, and then obviously observe everything goes on and spend time asking the clinical staff any questions you may have afterwards. Okay. I'm not sure we have, I think that's the end of the questions currently on the list. Is there anything else that you would like to ask? Or anything else that I haven't covered already? No? Okay, well, in that case, I would like to thank you all very much for attending this afternoon. Hopefully you found it interesting, and hopefully we were able to answer any of the questions that you've put in. And if you're able to join us tomorrow in person for the live event that will be held at the Institute of Child Health, it'd be great to see you. You're very welcome. And otherwise, then if you're glad to get in touch, please use the contact details we provided, drop us a line, and we can answer any individual questions and also organize a call with you if that would be helpful. And hopefully you'll be looking forward to seeing you join us next year. So if you do, that'd be great. Very much look forward to it. And again, thank you for your time and interest in joining the session today. Take care.